Hi, I'm Casey Glade, and this is my return demonstration for NR 302 Week 5, the respiratory system. Knock, knock, knock. Hi, my name's Casey. I'm going to be your nurse today. Can you please tell me your full name and your date of birth? All right, thank you. I need to pull the curtain for your privacy here, and I'm going to wash my hands. Do you have any allergies that I need to know about? No? Okay. And are you in any pain on a scale from 0 to 10, 0 being no pain and 10 being the most you've ever felt? Okay, great, thanks. First, I'm going to start by just going over your general appearance. Um, it looks pretty consistent. You have no signs of acute distress noted. Your facial expression is within normal limits for the situation. Mood appears to be positive. Speech clear and easy to understand. Dress and personal hygiene appears within normal limits. Your level of consciousness, I'm going to do now. I know you told me your name, so can you tell me where we are right now? All right, and can you tell me the month? All right, and then can you tell me why you're at the hospital? Okay, so patient is alert and oriented to person, place, time, and situation. Okay, next we're going to go over your skin and your nails. So as I look at your skin, it appears appropriate for the ethnicity. I see no signs of cyanosis, no jaundice or arrhythmia or pallor noted. I don't see any lesions or wounds throughout. I'm just gonna feel your skin temperature. Okay, skin feels warm and dry throughout. I'm gonna just assess your skin turgor. I see no signs of skin tenting are noted. The nail color appears consistent with your skin color. The shape and the contour is within normal limits. No clubbing appears. Now for your head, your face, and your neck. Just inspecting your face, and it seems symmetrical. All the face structures are symmetrical. I see no signs of drooping. I just need to look at your hair here. I see no signs of infestation, no lesions, no dandruff or lice or ticks are noted. Just looking at your neck, the trachea appears to be midline. No goiter or masses are present. All right, now we just need to look at your eyes. So first I'm going to look at the outside structures. I see no discharge, redness, or lesions. Looking at your eyebrows, your eyelids, and your eyelashes. Your conjunctiva is pink and moist. The sclera is nice and china white. Your pupils appear to be about 6 millimeters in size. They're equal and round. Oh, and as I do that, I'm pulling down your eyelid while I'm looking at your pupil, your sclera, and your conjunctiva. Next, I'm going to see how your pupils are reactive to light. So, great. All right. Pupils are reactive to light. I'm going to test your accommodation. I just want you to look at this object and focus on it as I get closer to you. Just keep looking at it. All right, accommodation is noted. Perla is intact. Okay, next we need to go over your ears. Sorry about that. We need to go over your ears. I'm just going to look at the outside of your ears first. You see no lesions. You don't have any piercings that I can see. There's no discharge, swelling, or redness coming out of your external auditory meatus. I'm going to have you plug your ears now, and I'm going to whisper in your ear, and you can tell me if you hear it or not. So plug this ear, and I'm going to whisper over here. Okay, great. And now I'm going to go to the other side and do that again. You just cover this ear. Okay, great. Patient appears to be hearing appropriately. I know in a real world situation I would go to the other side of the bed, but for these purposes, I have to stand over here. Okay, now we're going to look at your nose. I'm going to look at the outside. See no lesions. Position is midline and on your face. It appears to be symmetrical. And I'm going to have you look up now. Okay, I see no deformities, no asymmetry or inflammation are noted. Just need to look at your nostrils. Okay, bilateral patency. I see both nares are open bilaterally. Next, I just need to shine the light up your nose. Okay, I see no signs of drainage are noted. All right, next we're going to look at your mouth and your throat. So first I'm just inspecting your lips. Color appears within normal limits of the skin color. The color, it appears pink and moist. The tongue and your gums, your buccal mucosa, your palate are all also pink and moist. You show me your teeth. Okay, and they appear healthy. I see no issues noted. And the pharynx appears to have no redness or drainage. Okay, and now we're gonna look at your chest. So your accessory muscle use is within normal limits. Now I'm just gonna take a listen to your lungs. Start out with the right upper, left upper, left upper, right upper, left upper, right upper, right middle, left upper, right middle, left upper, left lower, and right lower. All right, great. Now I'm going to have you turn over to your side on your back side. As you turn, I'm just going to inspect the curvature of your spine. I see no signs of scoliosis, kyphosis, or chordosis. All appear within normal limits. Your AP to transverse diameter is within normal limits. And now I just need to auscultate the posterior lung spots. And then we'll be all done. I'm going to go with the right upper, left upper, left upper, right upper, left lower, right lower, right lower, left lower, left lower, right lower, right lower, and left lower. Okay, and that completes it. I thank you very much. Turn around now. Give you your call light. I'm gonna wash my hands, and you call me if you need anything. Thank you very much.